Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department, doing our weekly COVID-19 update for the town of Falmouth. Today is May 14th, 2021. For the most up-to-date information, you can visit the town's website at falmouthma.gov, and that'll have there's a COVID tab that's got the most recent information. Any COVID vaccine, as far as getting an appointment related, is our email is health@falmouthma.gov. Our phone number is 508-495-7485. You can also call the county number at 774-330-3001. There's the hotline still there. So where are we? So this changed from last week because everybody over 16 was eligible. Now with Pfizer approval, it's individuals 12 and over are now eligible. So there's plenty of vaccine available, and we'll talk a little bit more in detail in a second. So again, you can go to our website, okay, click on the COVID-19 tab. The two red arrows indicate where you can get appointments. Again, you still have the pharmacies, you still have lots of places to get it. The Community Health Center has been working primarily out of the Barnstable County Fairgrounds. If you click on there, they'll talk about where their doses are, what they have coming up. Also, the state and Barnstable County, it's a pre-registration system, but you're going to get a note relatively quickly because the appointments are not filling up. So you'd get a relatively quick response. It might be at the 4Cs or any of the state sites. You could also do that as well. Vaccinefinder.org can get you to the pharmacies and grocery stores that have pharmacies. So there's plenty of availability. We're actually not filling the clinics. Yesterday we did a clinic from 3 to 6. What was it yesterday? It was Wednesday we did a clinic from 3 to 6 at the fairgrounds. I believe we only had 50 people show up. We had 25 pre-register. So there's plenty of opportunity for doses. If you click on, going back up here, if you click on that first arrow, the first bullet point, Community Health Center, brings you to this page. For example, the Community Health Center is going to do a no appointment necessary Johnson & Johnson on the 20th at the fairgrounds from 11 to 2. And so you could just show up and get a shot. So there's plenty of opportunity, and we'd like you to take advantage of it if you want a shot. The pre-registration site, if you clicked on the state site, would take you through here, and you just fill out the pre-registration, and then you'll get a pretty quick appointment. You can go on max vaccine availability. You can get it through the same website. You can get onto the pharmacies, which will go directly to them. You'll deal directly through their website to register as well. Again, there's multiple sites. All the blue indicate all the different sites for pharmacies. All the circled ones are run by either the Barnstable County or out of Cape Health or Community Health Center. But eventually we're going to stop doing the big, large clinics because we just don't have a lot of desire, and we're going to work our way to smaller things, more pointed, such as maybe at ongoing events, summer events, things like that, having a pop-up here and there to try to catch people that may want it. It's a lot of work to put on a clinic, have the fairgrounds opened up, the volunteers waving people through, and only have 50 people show up. So eventually we'll be sunsetting those, and plus the fairgrounds would like to become a fairgrounds again. But I think the 4Cs will stay for a while, but there's plenty of availability. There's no reason, nothing should be holding you up. If you are having difficulty, you can call the health department. We'll help you. But that's where we're at with that. As far as, again, if you're homebound, you still want to call the senior center, 508-540-0196. We have the Community Health Center. We also have the VNA working towards any homebound that might want to get vaccinated, that hadn't had a chance to get vaccinated. We still have the senior process where you can call the senior center and we can send your information to Cape Cod Healthcare. But that isn't, it's so easy to get a shot now, even the pharmacies and so forth. You can call the senior center if you're having trouble. I think just about when I show you the vaccine rates, just about anybody who's wanted one at the older age brackets has pretty much had a chance to get it. If you look at our vaccination rates, first doses, we're at 68%, which is a 2% increase for the Barnstable County. Looking at fully vaccinated, we're at 4%, but same amount of percentage increase from last week at 54%. Have had their second doses or had J&J and are considered fully vaccinated. In Falmouth, here we are. So we've had a net increase of 2% to 69% of the population has been at least one dose. And if you factor out those young kids that are not eligible, we're somewhere around 80% of eligible people who have had at least their first dose in Falmouth for a total of 21,400. As far as second doses, fully vaccinated people were at 55%, so a total of 17,187. You can see where the increases in the brackets, I show you where the parentheses, where the brackets where you see the increases are mostly through the more recent eligible population, 30s, 20s, 50s. You see the highest increase among second dose because they got on earlier the first dose, now they're on their second. So those numbers will continue to increase because some of these doses are like Moderna is 28 days and Pfizer's 21 days. So it takes a few weeks to get those that had their first dose get their second. So those numbers continue to increase. They're pretty good. They're real good. They're still better. They're better than average for the Cape. Definitely better average for the state, and definitely way better average than the entire country. We're pretty solid with that. So that's our weekly total number of vaccines given. As far as cases go, 1,550 cases. We had 15 over the week. We had 13 the previous week, so we're about in that pattern of looks like in the teens right now. 8 probable cases. There's definitely a drop in probable cases. We had more than that. I think we had, in the teens last week. So we're still seeing cases. It's definitely a lot better. And so we just like to see that continue to drop, and I think it will. If you look at our case count, again, we had April, we had that real high spike, and it's come down, 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 down. Now it seems like it's sort of a flat pattern in the low to mid-teens. The vaccine, as people get vaccinated, the disease doesn't have as many people to go to, as many people to infect. And that number's dropping, and hopefully it just gets well into the 5 to 0 range in the next couple of weeks. We can see that our curve has been flattened, though we want to see this line to be as flat as possible. You can see that we have had this is like our third time where we've flattened it. So you see it goes up, and then it flattens all last summer. Then you get into the holiday season, it really spiked up. And then it flattened out a little bit in January, started doing okay. Then we had that spike up again in the mid-Cape spike in March into April. Now we see it sort of slowing down again. As far as our metrics and what we get for our weekly, we're finally green. We were really close to green last week. So this is a little bit delayed in data. This is up to 5.8, so it's started to collect some of the really good weeks we've had the last couple. Our percent positivity is 1.87, so yay, we're under 2. Last week we were at 2.79, so it's a pretty good drop. There's only, 6 communities that are red: Edgartown, Acushnet, looks like New Bedford, Taunton, Lowell, and Lawrence are the only communities right now that are in red. You see more and more green, less yellow. You eventually want to get into the grays where it's less, real low. Barnstable County's percent positivity is 2.3. The state's is 1.48. So things are definitely getting better on the case front and also getting better on the vaccine front. That's what we like to see. Barnstable County, again, number of cases, you can see that they continued to drop. Great there. Hospitalizations were a little higher this week in Falmouth Hospital. Nobody in the ICU, but we had 6 as of 5/12, which we had been doing in 1, 2, 3, as high as 5. So a little bit higher on the hospitalizations. Again, it depends on who it hits, and generally the older population, if you hadn't been vaccinated, you have more likelihood of being hospitalized with it. In terms of the cases for the state, we've been under 1,000 pretty much for the last week or so, several days to a week. So we're at 616 yesterday. Most of the cases still falling in the, more recently allowed to be vaccinated group, or the group that can't be vaccinated. You're seeing that the deaths are dropping. There was 9, there was 0 the other day. So you see that dropping. You see the percent positivity is well under 2. And we're still doing quite a few tests. We're still between usually around 50. This one was 73,000 tests per day. That's a good amount of tests. So the metrics, again, looking good at the state, looking good at the town, looking good at the county. Everything seems to be dropping. You can see here that everything is on a downward trend. As far as testing in Falmouth, nothing has changed. We still do through the Cape Cod Healthcare Call Center. Also at the pharmacies like East Falmouth CVS, the walk-in like Convenient MD, Community Health Center still doing tests. Barnstable County's still doing it on Tuesday and Friday. You just can go online at capecodfairgrounds.org or call the 508-563-3200 number. They do it generally on Tuesday and Fridays for a test. In terms of guidance, the guidance I've had this slide on, I think, last week as well. So, we're allowed to open up things like road races, tournaments for sports. Singing is allowed. Theme parks, amusement parks, 50%. And then places like Gillette and Foxborough currently at 25. And then you move to the 29th, the indoor Gathering limit goes to 200 in, 250 outdoors. Street festivals, parades, and agricultural festivals at 50%. Breweries, wineries, distilleries will be allowed seated service only. Again, these things could change as the data gets better. The governor's hoping by August 1st to have capacity at 100% for all industries and businesses. But August 1st, you allow dance clubs, nightclubs, ball pits, things that, higher contact areas like the kids like that. Indoor water parks, saunas, hot tubs, fitness centers would be allowed by August 1st, with the ability to move this date up again if the data shows that we should. You may have heard on the news yesterday that CDC recommended that if you're fully vaccinated, you can go without wearing a mask or staying 6 feet apart, except where required by federal, state, local, tribal, or territorial laws. The state has not adopted that yet, so we're still at the same masks indoors. But if you get to, if they do adopt the state, you may start seeing that maybe as early as next week. I'm not sure. The CDC guidance has changed, and we follow the state guides. CDC puts out recommendations, and the states adopt them. So, again, the data's good, things look good, people have been getting vaccinated, we're pretty strong on our vaccinations, and we get to reap what we sow, and so we get to the point where we can start resuming activities that you did prior to the pandemic. And this is for people that have been vaccinated. Those that haven't been vaccinated, you'd still be wearing a mask. Travel, you don't have to show a negative test, you don't have to quarantine if you've been exposed, all if you've been vaccinated. So this is right off the CDC's website, and then the state's in the process of updating their guidance, and they may adopt all or some of these. So that's, again, as a result of the disease having trouble spreading, mainly through vaccinations. So as a recap, vaccine, I should have changed this to 6 to 12 or over. Falmouth residents are similar to other Cape towns, slightly better than some. We're definitely better than, we're definitely above average in terms of our vaccination uptake. Plenty of vaccine, please take advantage of it. You'll start seeing some of our clinics slowly go away from the larger clinics to small pop-up style. You'll always have there's plenty of vaccine at the pharmacies. So sometimes at some point it doesn't make sense to run large clinics and have few people show up. Again, states showing decline and decrease in serious illness, decline in cases, same with us. We've had a good 6 weeks, 6-week downward trend, pretty flat now. We all are also, and this may come out very shortly, we are working on school-based clinics for 12 and above. We were working on that today to get that shored up. You'll see, if you have a school-age child above 12, we're working on setting up clinics that'll be school-based during school time, and then you'll hear from the school department on that. So that's the update for this week. Things are looking good, and I'll talk to everybody next week. Thanks.